COVID vaccine is messing with some women's mammograms. A side effect from the Pfizer and Moderna shots could show up as potential cancer. And at your side, Stephanie Harris is here with a new recommendation from local doctors. Stephanie.
Tom, both Chesapeake Regional and Centera Healthcare want to alert women to a trend that they're noticing in some women who have received the vaccine: swollen lymph nodes under the armpit near where the shot was given. When it comes to mammograms and COVID vaccines, timing may be everything. Doctors are now recommending women schedule their mammograms before their first shot or 4 to 6 weeks after their second dose, if there are no major concerns.
We don't want somebody to delay if they have a lump or discharge or pain or any clinical symptom. We don't want them delaying.
Dr. Talukdar, co-director of Chesapeake Regional's Breast Care Imaging Center, started to notice a trend about a month ago and reached out to colleagues.
Then you realize that the handful of cases you're seeing, there's also a handful of cases in New York and a handful of cases in California. And you start to kind of get that, feeling this is maybe a bigger deal.
When a radiologist reads a mammogram and finds a swollen lymph node, they wonder if cancer is hiding out there. So they'll call the patient back for more imaging. That can cause anxiety and cost more time and money. But if it's after a vaccine,
the lymph node, the enlargement of the lymph nodes, there's nothing to be worried about.
It's a sign that your body is building an immune response to fight the virus. That's what it's supposed to do.
This doesn't mean there's any problem with the vaccine. The vaccine is safe.
If you already have a mammogram scheduled, talk to your doctor about the timing. But Dr. Talukdar strongly advises don't skip either one.
As your turn comes up, get your vaccine. This is just us trying to make sure that we take care of your breast health and also take care of your overall health at the same time.
And the doctor noted that even though they have seen an increase in these swollen lymph nodes, the vast majority, 85% plus, he says, have no change in their mammogram. Stephanie Harris, 10 on your side.
Thank you.